a lot of studies are coming out now that even in the womb,
Yes.
the child can be affected by an addict.
Sure.
What do we know about that?
But certainly on a physiological level, because of some drugs can pass the blood placenta barrier, where basically really the placenta, woman's placenta in the womb is a barrier to a lot of chemicals that blocks all these, let's say, for instance, some antidepressants or anti-anxiety medication or even real drugs from, or just general drugs from entering the womb and the child's bloodstream, but not all of them. So ultimately, that's where you see the fetal alcohol syndrome, or
What's that?
well, that's children who are born to alcoholic mothers, where they have deformations. They have both brain damage as well as facial and body deformations, and they become intellectually disabled. They become emotionally disabled. They have developmental challenges in terms of their physical growth, and again, like I said, facial and body features. So
This is due to excessive alcohol intake
excessive,
for the mom.
that's excessive, and also the earlier the worse, because when mothers abuse drugs in the early stages of pregnancy, that's where the whole neuronal system hasn't even developed yet. It is just developing at a cellular level, which affects everything else from then on. If the alcoholism happens, let's say, in the last couple of months, there's less damage compared to if it is happening in the beginning 2 months. Because it's really, as you know, a child really comes, is developed over time from an embryo into a fetus and gradually into a child form that we would recognize on the ultrasound and so forth. We say, oh yeah, it has all the features, and it's kind of a grown, baby that hasn't been born yet, right? Unborn baby, if you will. But it takes that 9 months, and throughout those 9 months, anything external can physiologically affect the growth and development of a child, whether we talked about neuronal level, cognitive level, because certainly brain doesn't just start developing after birth. It has already started from more or less second or third month, right? There's some cells, neuronal stem cells that are developing. So brain functioning can be affected, cardiovascular functioning, neuronal system, the neuronal network, neural pathways, musculature, skeleton, everything, all the organs, everything can be affected on a physiological level. But then in addition to that, too, what can be affected is more or less the brain ability or functioning that later on after birth would be characterized as, let's say, cognitive functioning or attachment or emotional health of a person. Their temperament by itself can be affected. Temperament, that's the genetic...
Even before they come out of the womb.
Yes.
Wow.
But well, it is formed. Again, it's not like... That's the thing. If we really want to understand psychology, we have to go all the way back to this combination of biology and psychology. That's why we have neuropsychology. The neuropsychology is that cross-section. It allows us, or biopsychology, or psychobiology, it allows us to see psychology in conjunction with the body rather than separate from the body, right? So where did the body starts? Where does the body start developing? Not after birth. It has already started before birth, which is in the womb, right? So if you combine these two, and in terms of psychological functioning, for instance, hearing is a psychological functioning. It's a psychobiological functioning. We need the ears, right? The inner ears. We need the whole, auditory system, including brain regions, to be able to hear. Well, they exist before birth.
My wife says I don't have any, but okay.
You may not.
Yes, yes. That's really amazing.
Isn't it?
And then one more question in regards to cocaine.
Yeah.
There have been a lot of studies, I think, with cocaine users that got pregnant. That really affects the child. in a very bad way, doesn't it?
Absolutely, yeah. Again, I'm not an expert on, let's say, child development prior to birth or even after birth as it relates to this drug abuse, to the depth of explaining in details what those detrimental factors are, again, in detail. But yes, generally, as I mentioned, whether it's heroin or cocaine or alcohol or methamphetamines, these hardcore drugs, and some prescription medication, including antipsychotic drugs, anti-anxiety drugs.
Oh, really?
Yes, they can, narcotics, narcoleptics, basically kind of sleep medication, painkillers. A lot of these various drugs can certainly cross that placenta blood barrier between the mother and child. When they enter the system, they can affect anything and everything. Now, certainly cocaine is a stimulant, right? The same thing with methamphetamine. Those are the stimulant category, and what the damage is from that type of category is to some extent similar as well as different to another category. For instance, let's say depressants, right? So the alcohol is a depressant, or narcotics such as heroin and morphine and opium and so forth, opiates. So
does it make them more prevalent becoming addicts themselves if their parents, let's say the mother had a drinking problem throughout their birth? Does it make it more likely for them to become an addict or alcoholic later? Do we know?
It depends. I would say certainly there is that predisposition, right? So, but then also it can work the other way around, meaning that it can almost like immunize them, not scientifically. I mean, just I'm kind of talking anecdotally, more or less. Because it really it depends on multiple factors. How does that child grow up, and what is their psychological contribution? If a child is smart enough to kind of make sense and meaning out of that challenge and struggle that they're growing up in, such as the environmental factors, again, going back to the lack of availability of a parent. Let's say they have been, in terms of physiologically, they have been exposed to drugs, right? From even before birth and then after birth, right? Well, it's in their system. Their immune system has dealt with it. Their DNA is kind of responding to it. But that's not the whole picture. What about the environmental factors? What about the influence of other family members who are not addicted? What about the influence from peers? What about the education they're getting at the school? What about their personal choice? How to deal with pressure, pain, unavailability, lack of trust, attachment, things like that. So it's very hard to say that for sure, like which way it will turn out to be. And in no matter what research we do, there's always that rule of the rule of the third that you always find. There's no research that finds 100% guaranteed outcome with whatever it is being researched. You find 1/3 of the population that is kind of complying and is aligned with the expected hypotheses. That 1/3 that is completely contrary to what you thought, and the other third that is kind of has a placebo effect, is not affected by this whole thing either way. So it is hard to say, but certainly even a physical deformation is not a good thing to have, let alone a cognitive or emotional deficit for a child that has grown up and been exposed to alcohol or any of these drugs pre-birth. It's not going to be a pleasant ride in life.